All right, good afternoon. My name is Samuel Price. We're coming to the end of this class, and we're instructed to create a short presentation about our roles after graduation and what that's going to look like after graduation and licensure as new nurse practitioners. Me specifically, I'm in the psychiatric mental health nurse practitioner program. My ultimate goal is to work at the VA, serving veterans, serving people that have served us. They just started a psychiatric nurse practitioner residency program at the LA campus. It's the only one of its kind in this area. I am able to apply there and between January 15th and February 15th of the year that I graduate. As long as I graduate by August 1st, I can start with that cohort. The first cohort was actually last year, August 2023. So the second one is picking up um, in 2 months. The VA does tend to retain their NP residents. However, it's not guaranteed. So I would have to go in there and show myself as competent and really be able to speak to veterans in order to be hired on there, which I feel like I can do that. I am a veteran myself, served 4 years in the Marines. I have many friends that use the VA services. Some people that should be that aren't. And I already work as not really a mentor, but definitely for peer support for my brothers that to kind of help them get services. Um, the residency program does work in various areas of the hospital in the outpatient settings, from psychiatric emergency medicine to outpatient programs, substance abuse. They have all sorts of mental health support that's there that we'll be working through and rotating through in that program. Prior experience with veterans or veteran status is something that is looked favorably upon just because you're able to speak to the veterans. But being able to speak to veterans and show them that you understand what they're talking about goes a long way in building rapport and building trust. Some skills necessary for working with veterans as leadership is one of them. That is, you need to be able to speak to them, be confident in what you're saying, and usually direct. In my experience, you want to be direct, tell them exactly what you're thinking, and help them get to where they need to be. Critical thinking, you have to be able to see the problems that they're not telling you, because a lot of times people will be closed up and unable to or unwilling to speak to their own problems. And social skills, again, be able to speak to the veteran. Um, Another thing that will help would be knowledge of combat-related injuries. Combat exposure increases the risk of poor health and disability. These are people that have TBIs, they've lost a limb, and they are dealing with the lingering effects of these things, how it affects your quality of life. And not all injuries are visible. You have PTSD. You have to be able to speak to veterans and understand what the triggers are for PTSD symptoms and how to help manage them, get them to the appropriate resource if you are not that. Some social and global factors that could affect this. Social factors, increasing demand for mental health services for veterans. There are currently 22 million veterans in the United States. 30% of Iraq and Afghanistan veterans will need mental health services. Half of those who need the help receive it. And this goes back to what I was saying before, where there are a lot of veterans that are out there that should be receiving services but don't. And a lot of this is, it's stigma that's associated with it. I don't need help. I shouldn't get help. There are people that need help more than I do. So a lot of times they need to shove or nudge, a helping hand to kind of get them out of their own way to get there for the services. And the currently 22 veterans commit suicide per day. Now, this is a stat that I've been hearing for years now, and I haven't been able to find anything updated that has countered it um, or disproven it. So this is obviously a very serious thing. This population is a population where if they do decide to take their lives, that they're very successful at it. Also culturally competent care for the veteran community. Veterans come from all walks of life in the United States. Ev all economic status, racial, gender, all of that comes from our veterans, and you have to be able to speak to them individually. Again, you can make a meaningful impact on the lives of those who have served. So again, provide service for those who have served us. Global factors, understanding the unique mental health challenges faced by veterans. Again, um, this falls into like trauma, the ability to um, move back to civilian life safely and being able to be productive. And again, global and global conflicts are not going away. So there will always be a need for the military, and there will always be conflicts where people have to come back and receive services from. That's not going away. We know from looking at the world today that hopefully we're not going to a place where it's going to get even worse. Economic and legal factors. As of May 2023, the annual mean pay is 128,490. If I am in the residential program, or I mean excuse me, the residency program, I'll get $89,000 a year. I mean that's an economic impact for myself, my family. That's less than what I make now. So there will have to be some sacrifices, but for the duration of the program, the experience I get and hopefully the foot that I'll get through the door with the VA will be invaluable. Primary billed services for psychiatric mental health nurse practitioners is medication management. That's generally what the billing is for. Telehealth and substance abuse treatment are also big as well. As far as legal factors, there's the bureaucracy in each state, the regulatory environment for APRNs and mental health APRNs specifically was shaped by professional lobbying initiatives and compromise between stakeholder groups. These are all of your medical associations, how they compete for what kind of services you're able to provide. Just like we learned with the Safriette paper and that conversation that we had, some barriers to full utilization, system barriers to hiring psychiatric mental health nurse practitioners. Again, that's the doctors who are used to where they are and keeping nurse practitioners pigeonholed where they are right now. A lack of role appropriate job descriptions, confusions related to scope, practice, supervision requirements. Again, this changes state to state. And challenges in recruitment and retention. Pioneer that I was looking at was Hildegard Peplau. Hopefully I said that right. She was an Army Nurse Corps station in England during World War II. This was actually where the American School for Military Psychology or Psychiatry was. So she was able to work directly with all the top minds in the military. You can imagine being in World War II with all of the injuries, both physically and mentally, that are coming back. Working with that population, understanding that there is a need for other kinds of services that weren't being provided at the time. When she actually came back from the war in 1946, she worked with those same people that she worked with at the American School for Military Psychiatry. And she used the experiences and the interactions she had to help with the Mental Health Act of 1946, which was the first of its kind in the U.S. She also established the first graduate level program at Rutgers. She wanted a more active role for nurses in the care that they provided. Up to that point, nurses were pretty passive, and she wanted nurses to have more of a say in the care that was provided. She also worked on or created the interpersonal relations theory, which emphasized the nurse-client relationship as the foundation of nursing practice. This is a theory that a lot of us looked at previously in this course. Lastly, talking about the Beatitudes, Christian worldview, and working at the VA as a psychiatric mental health nurse practitioner. The Beatitudes in psychiatric nursing, you can apply the Beatitudes to the role of psychiatric mental health nurse practitioner. First here is, blessed are the peacemakers, for they will be called the children of God. Matthew 5:9. Blessed are those who mourn, for they will be comforted. Matthew 5:4. Lastly, speaking about the Beatitudes, Christian worldview, and working as a psychiatric mental health nurse practitioner at the VA. The VA and psychiatric nursing, applying the Beatitudes to the role of nurse practitioner. Blessed are the peacemakers, for they will be called the children of God. This works with the nurse's role and specifically the psychiatric mental health nurse practitioner's role to bring peace and guidance to the people that they're caring for. Blessed are those who mourn, for they will be comforted. Matthew 5:4. This is specific with the veteran population. These are men and women that who a lot of them are dealing with loss, with trauma, with the loss of uh, brothers and sisters in arms, with the loss of limbs, a loss of the worldview, things of these sorts. Um, and it is our role as nurse practitioners to help guide them. You have humility, compassion, and then dependence on God in practice, dependence on God in all things. The Christian worldview and psychiatric mental health nurse practitioner practice. There's the importance of nurse-patient relationship in a Christian worldview. This is pretty clear. You want to In the Christian worldview and psychiatric mental health nurse practitioner practice, the importance of the nurse-patient relationship in a Christian worldview. This is speaking to how you interact with your patients, um, keeping God first, speaking about hope and healing, cultural awareness and competence, evidence-based care for homeless and vulnerable veterans. Again, this goes to the Beatitudes. Blessed are the merciful, for they shall be shown mercy. And this is speaking to the vulnerable veterans and the homeless. A lot of veterans are homeless. A lot of people come back from combat, from serving overseas, and they can't get their head back to civilian life. They are unable to uh, function normally in society, and or what we consider normal. And a lot of times they are out on the streets due to substance abuse, mental health, and I hope to serve a role in helping that population and guiding them back on the right track. And here are my references. Thank you.